Madam President, for some time, the planets have started to align for the cause of health reform. And today, the President put in place some stars in Kathleen Sebelius and Nancy Ann DeParle for key assignments in this health reform effort. Both of them bring extraordinary qualifications for their positions. Kathleen Sebelius is a renowned expert on the cause of insurance reform. This is going to be especially important, Madam President, because the insurance model today is fundamentally flawed. It's all about cherry picking, taking healthy people and sending sick people over to government programs more fragile than they are. Under Kathleen Sebelius, I'm of the view we'll reinvent that insurance system. Private insurers will compete on the basis of price, benefit, and quality, and I believe we will have bipartisan support for that effort. The President has talked about it. Chairman Baucus has it in his white paper. Chairman Kennedy has long advocated this very different model of private insurance. And I'm pleased to say in our bipartisan Healthy Americans Act that Senator Bennett and I have sponsored, we include it as well. I think we are now seeing emerge a bipartisan consensus that each party has been right on fundamentals with respect to health care. Democrats have been right about the proposition that you can't fix the system without covering everybody. If you don't cover everybody, the people who are uninsured shift their bills to the insured, and they shift the most expensive bills. So my view is my party's been right on the question of coverage, and it is time to get all Americans good quality, affordable health care. I also believe that Republicans have contributed significantly because we do need a strong private sector, one that encourages innovation, one that steers clear of price controls and one-size-fits-all federal solutions. So I think there is an opportunity now for a wide berth for the private sector in the efforts to fix health care, as well as the efforts Democrats have made to expand coverage. And the fact is that fixing the economy and fixing health care are two sides of the same coin. For example, with the typical worker changing their job every few years, right now, the worker, by the time they're 40, changes their job 11 times, there really isn't a great incentive for private insurers to invest in prevention. So what the President seeks to do, Chairman Baucus, Chairman Kennedy, Senator Bennett, myself, the distinguished chairman of the Appropriations Committee, who is part of our legislation, we're saying let's make health coverage portable so you can take it from place to place to place as you change your job. And in the future, private insurance companies will have an incentive to invest in wellness and prevention and good health because people will be staying with them longer rather than in today's system jumping from one job to another every year or a year and a half. So, Madam President, I said the planets were aligning for the cause of health reform. With the appointment of two true stars, Kathleen Sebelius and Nancy Ann DeParle, the President took another significant step towards achieving our goal today. I believe after 60 years of bickering about this subject, literally goes back to 1945, the 81st Congress with Harry Truman, there is new momentum for an enduring fix to the challenges of American health care. And to make an enduring solution to those challenges require that Democrats and Republicans come together. I think that's going to be possible with both parties having the ability to secure major objectives they have worked for in the past. And with Thursday's summit coming up, I think the American people will see that now the hard work is going to go forward, and this time, after years and years of polarizing debates, there's going to be an opportunity to come together, and the Congress, with the leadership of President Obama, is going to take that opportunity.